When a patient has difficulty swallowing, the nurse must assess the patient's status and level of risk for aspiration and then explain why assistance is required. Important considerations when assisting with a meal or feeding a dependent person include what level of assistance is required, what are the person's feelings about needing help, what supplies and special equipment will enhance the person's ability to self-feed, and are dietary modifications required to improve swallowing efficiency or to reduce the risk of aspiration. Assistive personnel may then feed the client once you have provided specific guidelines. Explain the specific types of assistance that are needed. Identify any equipment and supplies required to assist in feeding or self-feeding. Review precautions to prevent aspiration. Also, review the signs and symptoms of possible dysphagia and aspiration, which must be reported to you immediately. Feeding a dependent person like Mrs. Berger requires skill and a gentle, unrushed approach. Encouraging personal choices can help to relieve feelings of helplessness and loss of control. Letting the person help to the extent possible is important for the person's dignity. Prepare Mrs. Berger's food for eating. Sit next to Mrs. Berger at eye level to convey that you have time and have no need to rush. This position also helps you see clearly if she has any difficulty chewing or swallowing. Ask Mrs. Berger if she has a particular order in which she prefers to eat specific foods. Serve foods in this order. Use a spoon for safety and fill the spoon about 1/3 full.
That go down okay? Would you like a sip of water or milk?
Alternate between solid and liquid
Or
foods.
the milk?
Allow enough time for chewing, never rushing a person who is impaired. For the neurologically impaired patient, be especially attentive to the ability to form a bolus of food and swallow it.
Good job. Can you open your mouth for me?
Make sure Mrs. Berger's mouth is empty before offering the next bite of food or a sip of beverage. Remember, a person with limited tongue strength and control
feeling?
may be unable to move the bolus of food to the back of the mouth for swallowing. Checking for food that becomes pocketed in the mouth helps to prevent choking and possible aspiration. Also, remember a person with dysphagia may benefit from liquids that are thickened with commercial products or from a change in the consistency of foods. Talk with Mrs. Berger and wipe food from her mouth and hands as necessary during the meal and afterward. Make mealtime a pleasant social experience. This is also a good time to learn about any concerns she has. Encourage Mrs. Berger to eat as much as possible. Take note of which foods are eaten and how much is eaten of each. Include in your notes the amount and kind of food eaten, the use of any assistive devices, if Mrs. Berger is unable to complete the meal, or if she complains of nausea, vomiting, diarrhea, or food intolerances. Also note the calorie count if ordered and fluid intake if it is being monitored.
Well, let's go ahead and just get you cleaned up then, okay?
Wait until Mrs. Berger says she is finished, then remove her tray.
Get this so we don't
Remove her clothing
spill
protector,
any of it.
clean any spills, and if needed, change soiled linen.
Let's go ahead and wipe your mouth off.
Provide for hand washing and offer oral hygiene before you leave. If you assist with oral hygiene, remember to wear gloves and wash your hands. Place the call light within Mrs. Berger's reach. Document your observations when you are finished.
All right, can you get to that okay now?